right, we are going to have a question and answer session related to parenteral medication administration. And do I have any questions?
Yes, I have one. What would you do if you didn't have the keys on you when you went to your med card? I saw that some nurses keep it around their neck. Is that okay to do?
That is the greatest question in the world. So my response to that is definitely no. So let's think about that a minute. If you take these keys and put them around your neck, they're going to be touching your hair, correct? So if you have anything in your hair that is going to contaminate these keys or the ribbon that they're held on, it's going to go right into your pocket, and you are going to be a great transfer of infection. The other thing is, if this gets contaminated in any way, because sometimes they do hang out of our pocket, we could think, that maybe they should be clean, but if they're not, and you put that back around your neck, you may be contaminating yourself. So I strongly advocate not putting the keys around your neck. Do remember always, though, that when you go to your pocket for your keys, your hands must be clean, either washed or sanitized, because your pockets are always considered clean. Great question. Any other questions?
Yes. Why was the MAR taken into the room? I haven't ever seen that done before.
In many instances, we do not take the MAR into the room. And one thing we want to think about, and we do teach you to do that in some of your facilities, you will be leaving the MAR on the cart in the room, and you will be doing your third check right at the cart, then right before you take it into the room, because you want to be sure you do your third check. We teach you that to reinforce that that third check is done. With an electronic system, you will probably have your electronic system in the room. If you noticed when I was administering medications, however, when I took the MAR in, I had a barrier down on the overbed table because that MAR is considered clean, and we want to have a barrier between that MAR and the bedside stand when we take it in. So frequently you will not be taking the MAR in, occasionally you will be. Another really good question. Anything else?
Should we be watching the TV site, and how often should we check it?
Oh my goodness.
I
I forgot to say that. I'm so glad that you brought that one up. You all are really challenging me. Actually, we talked about our intradermal injection, and it's so much like a TB injection that we do think of that. Your CBA has a little different time span to be checking. With a true TB, it's 48 to 72 hours within that window that we check it. Intradermal injections that may be given, for example, for allergies. Remember, the intradermal injections are always for some type of testing. For allergies, it may be a different time span. So the issue is that, yes, you will be checking. Yes, with the TB, it's 48 to 72 hours. Others, it may be different, but you'll always be checking them, and you'll do that according to the protocol for that particular test material. Thank you for that. Any other questions?
Yes, I had a question about the insulin. When you administer insulin, how would you mix the insulin?
We always draw from clear to cloudy, but if you will notice, when I was withdrawing those insulins, in order to save a step, because I needed to get air into those vials, that closed vial system, I put the air into the cloudy first, took my needle out, and then put it into the clear. Do the clear first, but now I'm ready to draw from the cloudy because my air is already in there. It's not wrong to put air in the clear, air in the cloudy, go back to the clear to withdraw your clear first and then your cloudy. It just saves you a step. If you air into the cloudy first, then air into the clear, withdraw from the clear, and then withdraw from the cloudy.
If you have two inhalers to give, and one was a steroid and one was a bronchodilator, what would you give first?
Wow, that's a trick question. No, not really. We would want to give the bronchodilator first because we want to open up that airway. Wait our number of minutes, probably 5, before we give the corticosteroid to decrease the inflammation. Thanks for that. Did you really know the answer to that
I
one?
did know the answer to that.
I appreciate getting that on our video, though. Anything else?
My mom uses an inhaler, and her doctor has her rinse her mouth afterward. I was just wondering if we would encourage our patient to do the same, and if so, why would we do that?
For most of our inhalers, we do have our clients rinse their mouth. It depends upon what the medication is in the inhaler. Sometimes it's because that inhaler, the medication will discolor the teeth, and we want to get that rinsed out. Sometimes it's because that inhaler, the medication, leaves a taste in the mouth that we don't want there, so we want to get that rinsed out. And sometimes it's just the natural flora in our mouth that we don't want to be destroyed, so we want it rinsed from the mouth, because we're actually administering that to the airways, that topical application into our airways. So, but let your mom keep rinsing if that's what her physician has told her to do, or what the directions say. Anything else?
No.
Thanks for the challenges. Thank you for today.